Hi, my name is Tani Jing, matrix number 1796330.
Hi, my name is Kirati Opasungku. My matrix number is 178167.
Hi, I'm Hidayatul Husna binti Salahuddin, matric number 180437.
Hi, my name is Nur Aisha Hida. My matric number is 178157.
Hi, my name is Siti Aisha Binti Baharul, matric number 180577.
Hi, I'm Chong Yingpeng, 179212. Hi, I'm Tanzani, 180353.
My name is Haizullah. My matric number is 177934.
Hi, my name is Dilian Xiang. My matric number is 177174.
Hi, my name is Katli and my matrix number is 177751.
So today we are recording the last video for this semester, for this last course. So today's topic is about the 9 case studies that our lecturer gives us. So we're going to start with the first case. So who can start first? The first one? Can read the history first.
So, guess what? 4 years old female poodle that was fed late tonight and now she is acting restless. Question: what is your radiographic finding?
Can you see the radiograph?
Yeah.
Yes.
Okay. They have a lateral view and also ventral view. View. So what can we find? What our finding from this radiography?
In the first lateral view, I think the stomach is very much dilated. And there's the feed material at the
And you can see some more the stomach is filled with gas. A portion of gas and a portion of food inside the stomach.
So how do you remove the feed material?
I can see the structure of kibbles.
Seriously?
Similar to the kibble size. It's like circular in shape.
But the radial opacity, I think is like more like bone or something like that.
No real hands.
Between soft tissue and bone, I think. In this case,
So it's thin,
it's like a
Bolus lah, feed bolus lah.
okay. So
So is the position of the pyrolus and the fundus normal in
no
this case?
I think position is
a
more.
position.
I think the position is more.
But I think it's volvulus. I think it's gastric dilation volvulus, which is the pyrolus move to the cranial dorsal part with the gas opacity, and the fundus at the bottom. Cannot see. Then the middle one is the body.
Now that you mention, I agree. I somewhat agree with you.
So usually where does the pylorus located?
On the right side of the body.
More ventral.
More ventral.
Right.
Right.
I think we can see better at the VD view. At the
Oh,
VD
yes,
view
yes.
is better.
Oh, yes.
I mean, the pylorus is not located.
Can you explain about in the VD view, right? Why the cupola is like very sharp? The very pointy
Cupola is very sharp.
The diaphragm, cupola of the diaphragm.
What's the stomach pushing the thing up?
Or stomach push the everything up. Then like the cupola.
The distended stomach.
I see. But in this view, the pylorus seems to be on the right position.
Yeah. I think this location.
And then we cannot see the gas. Why is it?
The pylorus.
Can you see the
Should we see gas on VD view?
pipe?
In some, or is it because it's so filled with food that you cannot see? Okay, never mind. So why is, I can see here the intestine move to
Yes.
the right side. So why
Yeah.
is it like that? Why?
Suan, can you tell us why the intestine move to the right side?
So like something on the left side.
Something on the left.
Quite radial or back. Yeah.
It's a real back region. on the left side of the soft tissue opacity.
Can it be fluid?
Possible.
Possible opacity can also be fluid.
And the wall is also like bulging out.
Yeah, yeah.
Possible.
So what would be a radiological diagnosis?
Yes, what gastric
Dilatation
dilatation
and
volvulus.
How do you know it's vulvulus? Or without vulvulus?
For me, I think there is a vulvulus because I can't see the normal like stomach like this. I can't see this part.
J shape.
Normal J shape.
Vulvulus means
Twisted.
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 So why does this happen?
Maybe because of exercise.
Okay, right.
Exercise, trauma.
After eating. So
Anything's possible.
Okay, so we move to the next case.
Yeah. Next question.
Case 2.
3 years old, still short hair, presented to UPH or OHD. Clinician could not auscultate the heart sound properly. So what is your radiographic findings?
So there's only one view.
Yeah, it's a lateral.
Now do you want to
Comments and
Comment on the
I think the heart silhouette is not look normal. Is it normal to look right? I mean, we cannot see the effects of the heart.
yeah. Increase the nerve contact.
increase the nerve contact.
Definitely.
I can see also that the trachea is slightly deviated dorsally.
Trachea is deviated towards
Slightly dorsally.
It almost parallel to the vertebrae already.
So when we have a slight curve,
Yeah. Sigma curve.
How about the diaphragm outline? Is it normal? I think in the middle part of the diaphragm is connected to the pericardial sac, right? Something is like
Possibly.
Corner region of the thoracic joint.
Oh, is
PPDH.
this a case of PVDH? Yes.
evil what?
PVH. Peritoneal, pericardial, diaphragmatic.
Cornea.
It's a congenital.
Yeah, it's congenital.
How old is the nose?
It's not necessarily
3 years
congenital.
old.
It can be traumatic.
Traumatic.
I'm not sure. I cannot.
But traumatic would cause a PVDH.
It's possible. It's
I think
possible.
it depends on the portion of the rupture and diaphragmatic.
like you did something as well to puncture the pericardium.
Yeah.
I think it's congenital.
I think it's contact.
It's congenital. But then if serious or not depends on the intestine probability.
So if it's congenital, maybe, so in this case, because the cat is 3 years old, maybe there's no problem, is it? Like, not necessarily there's a problem.
Or because the primary complaint is to do the OHD not because of the heart problem. They suddenly cannot auscultate the heart sound, so they discover this thing. So except the increased size in the cardiac silhouette and the increased nerve contact and the PPDH, the pericardial connect to the peritoneum, is there any other finding?
What do you think to the opacity of the lung?
Yeah.
I think the whole radiograph of them.
I think this X-ray is under exposed.
Oh.
Possible exposed.
Yes. So okay.
Anyway,
The question asks us what is our next move to confirm our diagnosis. So, Suwan, can you tell us?
After you make the radiograph, what you move to confirm your diagnosis?
Yes.
What other modalities? What
So that the camera can see.
like what other modalities or what other techniques that you want to use for the diagnosis?
Yes. what moon?
Contrast study.
Contrast study also can.
Yeah, can.
We will first give the dog a very view, and then we will take immediately after we will take a radiograph, and then after 15 minutes we will take another radiograph, and then another 15 minutes we will take another radiograph, and then we will observe movement of the very view in the GI.
Okay,
So if the very view appear inside the
Thoracic cavity.
the thoracic region, the lung field, then possibly we can definitely probably basically say it's there might be a hernia.
You mentioned that by removing Barrett meal, right? So the contrast study, I mean the contrast view showing the intestine or
stomach.
We don't know what's the extent of the hernia.
because I was thinking, would it be able to do through surgery
From the anus.
Yeah, from the anus.
I think if through esophagus is usually
Because the colon is quite
quite long.
and to reach the, but possible. Possible.
So how about do a DV or VD view
Oh,
to confirm the VVDH?
I think that will also be clear. Since
Okay.
you can see the diaphragm and the
Yes, you can see it connected, right? So we move to the case 3.
Oh, really, case 3, adult stray dog. Adult stray dog is sent to UPH by rescuer having acute hematemesis, melena, and hematophagia.
Oh, wait. Aisha, what is hematemesis?
They vomit blood.
Okay.
What is hematosis?
What is hematosis?
Blood passage by MS. And then I googled it, but I don't understand the meaning actually. So anyone can explain?
Kevin, can you explain?
I think it's basically blood in the poo
Yeah.
undigested.
So,
Melena is digested.
digested
Not
blood.
not region is like the lower tract.
Straight. If melena maybe like the yellow stomach or maybe
Upper portion.
But if clean, I mean, if we just observe that, can we know whether it's clean or
I would say that if melena probably is digested and is black color. And then like if it's hematophagia, probably it's like a liquid blood in the feces.
Yes.
So, can you tell us what is a radiographic finding?
Standard.
Standard colon.
You mean the colon is standard?
colon is
Volvulus,
Saying the transverse colon
transverse colon.
is standard.
Or large.
okay. What about in the stomach? Yeah, when is it stomach or is it a foreign body?
I
Yeah.
Possible.
So it's a stomach. It's a stomach.
Why would you put a scope like going to
Ah, yeah.
X-ray?
But this one is very good.
X-ray guided endoscopy.
No.
And one thing, because the dog came in with that clinical signs, so they say it's not possible for the clinician to do stomach. But then
Not
it
possible.
doesn't look like foreign body.
So what is that?
It doesn't look like.
So what is
If
that?
the dog intentionally eat a pie.
What is
Possible.
that?
Possible.
From the nosocomial view, it looks like
If you see on the DV view is VD view is it doesn't look like a normal stomach tissue. It's
That's
stomach.
But it doesn't look like it's in the stomach.
Yeah.
It's outside.
Okay, Okay, first we look at the history first. What will cause the whole intestine like bleeding? Let's cause hematitis, vagina, hematopsia, like whole clear part of the intestine to the back also like bleeding. Yes.
Yeah.
It's womb will cause.
And cytochrome.
I think womb will obstruct the intestine only. Won't cause the bleeding.
Someone force puke in the dog and put acid in the.
Possible? Was it not baby?
Possible. Possible.
Very good
What
imagination.
is a stray dog? Like some people when they're crazy, they'll
I'm not sure. These are abuse case.
Can I present to Dr. Lam later?
Same answer this, huh?
because I don't know what will cause hematosis.
Yes.
Hematosis.
The whole tract is like
I
bleeding.
think I've googled it before. All the 3 clinical signs will be present in gastric, hemorrhagic. Gastric. I'm not sure gastric hemorrhagic something, but that disease have no etiological agent.
Idiopathic, yeah.
Maybe it's there is blood in the stomach.
Yeah, somehow.
But how do we describe like the intestine?
Yeah,
Because
yeah.
like sausage, like very weird.
Yes.
That's the colon.
There's the colon
Is the
supposed to be like 2 line like that.
And I don't think, I think maybe it's like intestine dilated. Because you can see other parts.
But dilated at certain parts. only.
certain
some
part
parts
is-
are very
it's
quite
open.
open.
You see this one like small suddenly becomes
Yeah,
big, this
yeah.
suddenly becomes small
I
again.
don't think there's a colon.
Oh, it's not.
You can see the small intestine is moved towards the dorsal instead of the one branching out of the stomach. See? It's moving all around instead of the on the ventral
It's a
side.
small intestine. Okay. Gas. Is that gas?
Okay, we proceed to phase 4.
Let's
No answer.
Let's move on.
Skipping AIP.
Okay, Aisha.
So case 4, 5 years old Persian presented to your patient with a lateral recurrency.
Okay.
So what's our radiographic finding? Wow.
Wow.
Which?
What? Wow.
That's the case and with
Distended abdomen.
Yeah, distended.
Is that normal and then?
Okay, on the video, you can see everything is pushed to the right.
Yes.
One side.
wow, very good observation.
Why?
Is this like effusion?
Yeah, it's like fluid opacity.
Dominant effusion?
On the right side.
Vision, you may be able to see opacity, right?
Not necessarily excessive, it's
I
proteinaceous.
think the opacity is offset of
If it's fluid,
Is it,
and I think
is it,
because of the fluid, it's like
is it air or is it fluid or is it fat?
Because like macam between air and soft tissue or fluid, right? The radial opacity lah. Like the left side.
it's a bit like fluid.
Maybe it's a mixture of fluid and air.
Okay, possible.
Possible. Mixture. Mixture of densities.
You see from the lateral view, the cranial part of the abdominal organs like lifting,
Yeah.
lifting up.
Yeah.
And it looks more radiolucent.
In this view lah, more
But
radial
in the VE looks more
Radio,
radiolucent.
okay.
Yes.
I think maybe like
What about the diaphragm?
Yeah.
if it's air and the animal is on TV or video, either one, I don't know which one is this. Then shouldn't the air be moved upward and the organs wouldn't be pushed to the side in this manner?
So it's fluid.
So for me, I think it's fluid.
But fluid will be fluid.
Oh,
And the thing will
would be
yeah,
on one side, right?
Gravity.
Gravity will be fine. Did you think of that?
Is it?
But fluid is not as mobile as air. Did you think of that?
Okay, so it goes down.
Is it liposarcoma? Fat density in your place. I mean fat in your place.
So,
Then something push everything to the right. Maybe something on
it's
the
possible
left lah.
if it's fat.
But it looks like the right side of it. Yeah,
Yeah.
the side of the organ doesn't look like it's being pushed
Yeah.
by a mass. Because it still has a shape.
Yeah, meaning the organs is still feel more solid than the ones that
And usually liposarcoma is on the subclavian, right? And we don't see the skin bulging out.
Oh yeah, this is not the subclavian. So maybe inside the cavity.
Do we have fat under the muscle?
Visceral fat, maybe visceral possible.
Yeah.
Yeah.
It's possible, but not sure. Never mind, we move to the next case. Case 5.
8 years old, GSD presented to UPH with chronic. Okay, last case, okay?
Okay, that's
So,
case.
8 years old, GSD presented to UPH with chronic weight loss. So, what else?
Alright.
I think-
So first one, is it underexposed for this?
I would say so. Oh no, the esophagus was a bit dilated.
Esophagus.
Esophagus.
It's a case of
Yeah. How are you so sure with dilation of the esophagus?
because the distance between the trachea and the abdomen is a bit
Bit right. And we can also see superimposition between trachea and esophagus. We'll be able to see the line between them.
Is the aorta and lung?
Aorta.
I think that's not common.
but the aorta is
Dorsal part.
invisible.
Because it's a GSE.
Oh,
Much bigger. Much bigger.
Bigger than the big. Very big.
What's the chronic weight loss? That's it. Oh look at the time. It's getting a bit late, so I think let's conclude our discussion.
It's okay. Someone could put it
Should I even try?
for this one. Maybe you can try from the video. Oh, to summarize everything. This one haven't finished.
Summarize already, I thought.
Yeah.
Okay, so we finished to discuss 4.5 the fifth case is okay. So today we discuss 4 cases on radiographic findings, majority on thoracic and abdominal region. Yes. So this is our last video for this semester. So thank you very much.
Thank you.
Thank you.
Thank you.
Thank you for watching.
See you again
Thank you for watching.
next semester.
Hope that will be done next week.